So here we are, tip number 24. We only have about another week of tips left. And as I warned you, I'm going to wrap up our discussion on exercise today. I know this is the fourth day that I've talked about exercise, but my hope is you realize how important it is to health and human function, especially when we look at something like the immune system. Now, we know that exercise is a good stressor for the body, and the result of the stress the exercise places on the body, we have an internal coping mechanism. And one of the things that we do is we increase something called extracellular superoxide dismutase. And I know, super long word. All you need to know is it's an enzyme that actually helps limit free radical damage or oxidative stress on the body. And as we're talking about making the host more resilient, our whole discussion has primarily been on inflammation and limiting this oxidative stress. And that's what we're seeing with this current health crisis, or with COVID-19, is the individuals that are really struggling are having this heightened inflammatory response, and they're having extra oxidative damage. So superoxide dismutase has actually been shown to help prevent and possibly even be therapeutic for multiple conditions, anywhere from heart disease to COPD. And one of the things that we know that it could be beneficial in limiting or preventing altogether is acute respiratory distress syndrome. So once again, when we look at the individuals really struggling with COVID-19, a lot of them suffer from a bout of ARSD, or acute respiratory distress syndrome, and we know that this superoxide dismutase could potentially prevent that. So to make sure that we're a strong, healthy host, we have to exercise. Exercise will also decrease certain inflammatory cytokines, things like interleukin 6, but what it also does is it upregulates or increases anti-inflammatory cytokines. So we're talking about interleukin 10. So exercise not only does all of the other things that we already talk about, but it's going to limit our oxidative stress, and it's going to decrease inflammation within the body. So my tips for you guys is find an exercise that is appropriate for you, whatever your current fitness level is, and find something that is enjoyable so that you can continue to do it. If you find an activity that you absolutely hate doing and you force yourself in doing it, you're not going to enjoy your exercise. Now, if you are currently struggling with a health condition, please do consult your healthcare provider or your health professional before partaking in exercise. And if you're new to this, please get a personal trainer so that you can prevent injury. We got multiple good trainers in town. We work really well with Gold's Gym. I know all of their trainers really know what they're doing over there. So if you don't know what you're doing, if you don't even know where to start, please hire a professional. And what I want you guys to start doing is stop finding excuses not to exercise and start finding as many excuses as you can to exercise. I have given you plenty. Now, the last thing I want to talk about when it comes to exercise is the one time that you should not work out, and that's when you're struggling with an acute infection. So if you're fighting a cold, a flu, or whatever, and you have that general malaise, you got a fever, you're achy, you're tired, that is your body's normal intelligent response telling you to get horizontal and get some rest, which brings me to our next topic. Tomorrow we will be giving you some tips on sleep and why sleep is so important for a healthy immune response. Hope you guys have an awesome Monday.